Alrighty, respond to a man with chest pain.
Okay, so we have our BSI, we have our scene is safe, making sure there's nothing in our way, no animals like that. Hi sir, what's your name?
I'm Joe, are you Michael Jackson?
My name is Michael Jackson. Why'd you call us today, Joe?
This horrible aching pressure pain right in my chest. It's making it hard for me to breathe.
Joe, where are we right now?
We're in my house.
Okay.
Where else?
So I've checked his level of consciousness. Now I know he's speaking to me, his airway is open and patent. My breathing, I'm going to check his rate, rhythm, and quality of his breathing. He's breathing at roughly 20 breaths a minute. It's labored, and the quality, the rhythm seems normal. Why don't you get him on some oxygen? Actually, I'd rather you get him on some oxygen first before getting a set of vitals. Thank you. So we're going to put him immediately on oxygen before we go into anything else. So we're going to go right into our C, circulation, and we're going to check our pulse. Right, he's conscious alert, so I'm going to get a pulse. And the pulse is 100. Okay, we're going to check his skin color, temperature, and condition. And it's cool, pale, and diaphoretic. And meanwhile, I'm going to be talking to him and asking him a question, how he feels, what's going on, has he felt like this before. We're going to get a little bit more into that afterwards. I give a quick glance. I don't see any obvious signs of bleeding. Do you have any breathing injuries that we need to know about, or any?
No.
No? And what happened? What brought this on today?
I was just laying on my couch watching TV and it started.
Okay. Out of nowhere. So this is a high priority transport patient, right? We did our A, B, C, D. So we're going to transport this patient. So we put him on a stair chair, pick him up, get him on our stretcher. So for the demonstration, we're going to have him get up and sit on the stretcher. Okay. Why don't we have oxygen on yet?
I cannot find the nasal cannula for
side pocket. We never have a chest pain patient walk. Ever, ever, ever. Just so you guys know. Alright? So this is just for the demonstration. Alright, you're going to have to sit on that. Alright, so meanwhile, while we're doing this, I'm going to go right into my OPQRST and my sample history. So you already told me what brought this on, right?
Yeah.
Alright, so I forget. What brought this on again, Joe?
I was watching TV.
Okay. You were just watching TV.
Yep.
Alright, does anything make you feel worse or better? Does anything make you feel worse or better?
No, it's just constant. Doesn't change
After
at
you
all.
get the oxygen on him, I want you to get a set of vitals for me. Alright.
That's side pocket.
Yeah.
Back pocket.
Okay.
That code now?
Yeah, you're fine. Okay, so get a set of vitals for me, please.
Do you mind if I take your blood pressure?
Yeah, go ahead.
Alright, so we're going to hook that up. And what do you want to put this at? 15 liters per minute, right? He's having chest pain. Okay. So, I was asking, does anything make this feel worse or feel better?
No, it doesn't change. It's always the same.
Okay. Now, and how would you describe that pain?
It's just crushing.
Okay.
100.
It's 100. Alright. And so 1 out of 10, 10 being the worst, what would you say your pain's at right now?
It's a 10. It's just this aching, crushing feeling.
Okay, it's an aching, crushing feeling?
Yeah.
Alright, can you point to it?
It's just this whole...
Really? So it goes
crushing.
right there and it's crushing,
Yep.
right? And have you had this happen to you before?
Not really, no. I mean, I've never had a heart attack.
No heart attack, huh? And you've never felt this pain like this before?
Never.
Okay, and how long do you say it's going on?
I'm going on 3 hours now.
3 hours. Is this pain constant, or does it go away?
It's constant. It does
It
not
hasn't
change.
stopped going on. Okay, so we write down all those things.
One
My partner's
before.
going to be writing that stuff down while I'm asking him these questions. And what did you get for the blood pressure?
I don't have it yet.
Well, just tell.
150 over 90.
You got
150
150 over 90. Okay, what was his pulse? 100?
About 100, yes.
And his oxygen saturation was 95 on 15, 99 on 15 liters per minute. Okay, so it's 99. Okay, and his skin was cool, pale, and diaphoretic. So we're going to go right into our sample history. So our signs and symptoms: cool, pale, diaphoretic. He's experiencing chest pain. He's obviously in distress. Do you have anything else outside of your chest pain going on?
No,
Shortness of
no,
breath?
that's it. Why
Okay.
can't you fix it?
Why can't I fix it? We're on our way to fix it.
Okay.
Do you have any allergies, Joe?
I'm allergic to peanuts.
Okay, have you had any peanuts?
No.
Have you had any food that had peanuts?
Nope.
Alright, what'd you eat today?
Beer.
Beer. Good. How was it? Can you get a blood sugar for me too, please?
Yes.
Alright, thanks. So you've had beer today. Was it good?
Outstanding.
Was it a fall ale, winter ale?
Okay.
Okay.
Straight. I don't go
Okay. Did you take any medicine?
Yeah.
Nitroglycerin?
I don't take nitro.
Yeah, you do.
No, I don't.
I found it right here. It's on your dresser.
Okay.
We
Yeah,
can
you
we
take
can fake the
nitroglycerin.
blood sugar, okay?
Yeah.
All right, so you take nitroglycerin. Is this your nitroglycerin?
Yes.
Yes,
My
it
blood sugar
is.
is 132.
Can I see your finger?
Okay.
My blood sugar is 132.
All right, nice job on the blood sugar. I want you to go see if you can find med list and something else. Go see if there's any drugs or anything around the area. Go do a quick look around. All right. So this is your nitro. Have you taken this today?
No, I have not.
Oh, you haven't taken this today?
No.
All right. Well, so I know you take that. I know you're allergic to peanuts. And do you have any medical history regarding your heart, regarding your head?
I have hypertension, coronary artery disease,
Okay.
stuff like that.
No, not stuff like that. What else do you have? Tell me. Tell me this. Have you been to the hospital recently on an unscheduled visit?
No.
No, you haven't. Okay. And you said this has been going on about 3 hours?
Yeah.
Okay. Now, have you taken any asprin today?
No aspirin.
All right, what we're going to do is we're going to give you some baby aspirin. I'm going to give you 4 of them, okay?
Okay. What's
And
that going to do for me?
what's it going to do? It's going to hopefully make you feel a little bit better. Let's just call it, it's going to make your cells a little bit slippery to get inside of your heart to bring some more oxygen.
Just say if on my blood.
Okay. Why don't we do that? Okay, and I want you to take them and I want you to chew them around and not swallow them, and then I want you to put them underneath your tongue. Okay, do that for me?
Done.
There you go.
Can I have some water with that?
No.
Okay.
Not yet. Maybe get a little water a little bit later. But do your best, okay? But they're meant to dissolve in your mouth, so
Okay.
it's fine. Okay. So, sir, now this is yours. I'm going to do this. So this is the right patient. It's going to be going in the right route, which is going to put it underneath your tongue. That's how you normally take it. Okay. Then we're going to make sure it's the right time to give it to you. What did you say his blood pressure was?
Blood pressure was 150 over 90.
150 over 90. Have you taken this yet?
No.
Okay, just confirm that. And do you take any medications to help you with the male or female subjects?
No. No, sir.
No, I'm talking about erectile stuff.
Yes, I appreciate
You
it.
take
Put it
ED.
that way.
And
No,
again, I'm going to ask you one more time because this will kill you or could kill you if you take any medications to help you with men or women. No, okay. So what I'm going to do is we're going to take this out. We're going to open it. We did our 6 rights. Right time, right dose, right patient, right documentation. It's not expired. And we're going to make sure it's the right person. And in fact, what's your last name?
Peters.
Okay, great. So he spells that. So we take it out. Go ahead. Put that. I'm actually going to help you right here. Okay, we're going to put that in. Open up your tongue. Okay, good. So just leave that underneath your tongue, okay? We're going to do that. And now, what was the last thing you ate? You said you had beer?
Yeah.
Okay, and you just said you were doing nothing when this was brought on.
Nothing. Watching TV, drinking.
Okay. So we're going to continue on. So I want to get a second set of vitals, okay? Now, what did you say that number of the pain was?
We're at 10.
Still 10 out of
Still
10.
10.
Okay, so now it's been a few minutes, and you've taken that medication. Is that medication making you feel better?
I'm at an 8 right now.
You're at an 8. So,
It's
okay, so
still
we
crushing.
started
It's
trending.
still crushing.
I want you to get a blood pressure, actually, on that.
You got 140 over.
Okay, so our blood pressure's gone down to 140 over 80. All right, how do you feel right now?
Still like crap.
Okay, you seem to be breathing and speaking a little bit better,
My
so...
breathing's right. I still get that crushing chest pain. that
Okay,
aching
we're going to be at the
crushing
hospital soon. Okay, so we're 2 minutes from the hospital. We're going to give the hospital a call, tell them what we have on board. We have aspirin on board, we have nitro on board, we got oxygen on.
So you want to start an IVs on me or something?
Yes, we're going to start 2 IVs and the gold standard in the right hand for you. You won't be able to use your right hand later on tonight, so... All right, that's all set. And then finally, we're going to do our ongoing assessment to continue on doing our assessment of our patient of what's going on, okay? And how many nitros can we give per our